I have lectured about spironolactone for many years, and I can tell you many of the same questions surface every time. And they are questions about, I want to use spironolactone, I need something, but I'm worried about screening lab. Do I need to check potassium? I'm worried about breast cancer. How worried about that should I be? And so we've got some new data out there right now that lends support to us on both of those questions. So potassium, we've got some old studies that show that if you're using typical doses, 50 milligrams to 100 milligrams, and even some studies up to 200 milligrams, that the potassium has not really changed. And so most of us on the panel today, most of us would agree you don't need to be checking potassium in someone who's healthy, who's not on other drugs that could cause hyperkalemia, and has no other contraindication. With breast cancer risk also, there have been two large studies that have come out in 2012 and 2013. They're large database studies that look at women over a long period of time to see how many of them on spironolactone developed breast cancer, and in the end there was no association between use of spironolactone and the development of breast cancer in those large studies. I've used spironolactone for 15 years in my practice, and I've absolutely seen it offer efficacy to patients, even patients who have really not had efficacy with other drugs. But there's a right way to use this. I typically will start at 25 to 50 milligrams a day, and I let the patient titrate that up, usually maxing out at about 100 milligrams a day. Sometimes I let them titrate the dose on their own over the first few weeks of treatment, and then I see them back at the 3-month follow-up to check on them and to check on their progress. This is a long-term treatment, so this is not something that I'm thinking, I'm going to see you at 3 months, you're better, and we're going to start tapering the drug off. If this is a drug that works for you, plan to be on this long-term, unless you want to get pregnant or you have a side effect or have some other reason for needing to discontinue the drug. There are absolutely side effects, and many of the side effects, if you don't tell the patient about them, they may experience them and not know that they're secondary to spironolactone. So some of those side effects would be things like menstrual irregularities, breast tenderness and swelling, fatigue, headaches, and you need to talk about these to your patients up front and let them know that they could happen. Pretty much all of those side effects are dose related, so the higher the dose, the more likely the person is to have that side effect. One way you could handle the side effects is by reducing the dose, but sometimes over time with continued use, those side effects lessen on their own. So often when we're treating acne, we're using multiple drugs together, and spironolactone is no exception to that. So spironolactone, and I would have to say most of this is anecdotal data. You're not going to find a lot of this in the literature, but it's used in combination with other things that we use to treat acne all the time. So our topical retinoids and our topical benzoyl peroxides and even antibiotics. I would keep in mind that trimethoprim sulfa does also cause hyperkalemia. That might be one that you would think about. It's not an absolute contraindication, but you might be cautious if you're going to use those in combination. But short of that, really any of the other acne medications can be used in concert with spironolactone. Even oral contraceptives can be used safely with spironolactone. The one that would garner most attention from dermatologists is those that contain drospirenone, because we know that drospirenone is an analog of spironolactone, so they act the same. And so it's like having an additive effect of that, and do we have to be more worried about that? That has been published in the JAD. Those two used together 100 milligrams of spironolactone with a drospirenone containing oral contraceptive, and there was not a problem as far as potassium was concerned.